started talking about what we wanted to do here, we wanted to do something different, not standard quality or quality improvement, but something we hoped would have a true impact on patient health and outcomes. And to do that, what we realized is that the patient needed to be in the middle, in the center of what we were doing. Now that's easy to say, and it's another thing to actually do it. But what we did is we started with where is care delivered, and most care is delivered outside of the hospital and away from our clinic visits, but at the patient's home and in their real lives. And so we built a quality improvement project with the idea that we would start with where the patient is and go from there. These are high quality of care offices to begin with. So you might say, well, then what is different about it? What's different about it is the following, that patients have a way to be engaged in their care between visits. So since we focused primarily on blood pressure, although other cardiovascular risk and behavioral changes, but with regard to blood pressure, for example, they have a web-based tool that they can use and are encouraged to use and are trained how to use, as well as home blood pressure cuffs for monitoring. So patients are involved in monitoring their own blood pressure, tracking it over time with a goal in mind, knowing what medications they're supposed to take with reinforcement of adherence to those medications, but also a way to get to not only educational materials, but also to reach to their own clinicians, to their own doctor's offices, to either follow up on when they need medications refilled, to get an appointment, or to have questions answered, or if they're having any trouble with the medication. And I think in this way, patients end up not just receiving care from the healthcare system, but are part of the care that is being delivered. And we're hoping that this patient engagement makes the difference.
Going in initially, I was excited to, be able to give you this blood pressure cup and have you be a part of this project, to know that you can have this tool at home and take your readings whenever you want, and you know that if they're high, that somebody's always here for you to kind of walk you through it, talk you through it, and just help with the overall control of it.
It seemed to me when they explained it to me that it would be something very visual, something hands-on, that you could see results right away. And that's the kind of thing I like to do. And I'm kind of into technology anyway, so being able to get on a computer and monitor this was a plus.
I think this program has been more successful because most people are visual people, and when you look and when you can visualize your blood pressure number and actually see it, it gives you that accountability to know that when a patient has the ability to look at it and know that they're able to change it. I think that's what makes it more that's what makes the project, I think, works better, because you give them the tool and then they have it, and then they're able to visualize these numbers. They're able to hold accountable to whatever activities they may have done or medications they may not have taken. And so I really think the most important part of it and why it's been so successful is because the accountability is so much better with the visualization of actually seeing your numbers.
Yeah.
Mm-hmm. And you know that you can make a change based on it.
Yeah.
So for me, probably one of the biggest disappointments or the challenges was the IT. And it was like one thing after another. I mean, whether it was firewalls, interfaces, connectivity, and then people would back off, staff would back off. So then we had to start re-engaging again, and why are we doing this? Don't want to do this. So that was probably my biggest frustration. I truly think this project would have soared if we wouldn't have had that IT issue. And
that would be the most challenging part, is to identify the right patient who we feel like it's really going to benefit the most, and then to help them overcome the technical parts of it. And if they can't, then we can manage that from here absolutely fine.
Yeah.
Yeah. Mm-hmm.
Working with this project, we found that there's not one size fits all with patients. We had patients that were truly IT savvy. They loved being involved with the patient portal and the computer. And then we had those patients that were really intimidated by the computer. So we actually developed a patient log or a blood pressure log where they could keep their readings. So what we've learned from this is that we're going to have to look at all the patients as we're trying to get them engaged. And I would be a proactive advocate for really having a patient activation tool of some sort that we would use in getting the patients involved and seeing where they are in the continuum of being involved.
Well, being able to monitor my blood pressure throughout the day, a lot of times will take it with me at work. So if I feel that I'm a little stressed or something, I'm liable to take my blood pressure just to see where it's at. And that's helped me to kind of settle down on a lot of things. My supervisor is very good about this, and he said, you know, take 10 minutes, go for a walk, go outside, and just get away from it. And when I came back, it was a lot better.
In my career, I've really seen the importance of having a champion. I think that's vitally important. And with this particular project, we really saw that when we had a physician champion or a clinical staff champion, we saw things soar and really change and get that buy-in from all levels.
When we get a patient on this, such as yourself, who's done so good with it, it makes me feel like, you know, I'm just this one little piece and it's such a bigger thing. So I get to hand you the blood pressure cuff, but then you get to take control of it from there. So I love my patients. I love knowing that they're getting better, they're in control of their own health, and that they can be in control of their own health.
Yeah. Well, that comes across because
kind of
it's great, you know, having you there and all that you're there, you know.
For me personally, depression screening is very important when you're working with chronic disease, and we were able to incorporate that into this project. And how we did that was we developed a rapid improvement activity, which is an hour-long presentation where we introduced the depression guideline, and then we actually helped the practices develop protocols and processes to do this screening. We had a win on this one. We got all of 100% participation with the RIAs, and each of the practices now have protocols in place to do the screening and actually have resources available for the practices to refer patients to after they've done the depression screening.
This really was setting up so there's a patient interacting with their patient-centered medical home or their team, and yes, a specialist can and should be seen as part of that team. I think that and called upon when necessary, and certainly when patients may develop heart disease and so forth, then naturally the specialist may have a larger role or a more primary role at times. But the best thing, of course, would be to not need us and have effective prevention.
The preventative side, I think, is the first place to start. Once you have the problem and you work on it, okay, but if you know where that problem begins, it's easier and a lot faster and a lot safer, I think, to work on it. You start where the problem starts.
So if I had my way, everybody with hypertension or high blood pressure, cardiovascular disease would certainly be on this project so that they can see how important it is to them and how much it impacts their life.